Hello, welcome to MLS Quick Review. Today we're going to talk about hematology and introduce you to the red blood cell morphology, also the right Giemsa stain and peripheral blood smear. Our topics include briefly the right Giemsa stain, peripheral blood smear. We'll go into more detail with RBC morphology, and we have two parts to this section. The right stain is a Romanowski stain, polychromatophilic, many-colored loving. It has eosin Y, methylene blue. Methanol is a fixative with phosphate buffer 6.4. And we have a modified right Giemsa stain shown in this old Hematech stainer with Azure B added on. And this will stain for the xerophilic granules and polys with the methylene blue staining for the basophilic RNA granules, and eosin staining for hemoglobin, also eosinophilic neutrophilic granules, and the eosinophils in a right orange and red. Troubleshooting steps, look at the pH. If the buffer is too basic, then it'll become too bluish. And if it's too acidic, it will look pinkish. Look to see if the stain has blocked and see if the methanol is working properly and all the apertures are open. When the slide goes to the left, you'll see that there's open air drying, and if it's not dried properly, then you'll see water droplets on the slide. You want a good feather edge. This is not perfect, but let's see if we can work with it. Put a nice clean oil droplet right here and smear it across to scan with the 40 for 400 mag. And then for RBC and platelets, we want the oil immersion, and we'll start at the feather edge and move in this direction. We use the 100 oil immersion objective, which times the 10 ocular equals 1000 mag. Nowadays, medical centers with clinical labs use highly sophisticated instrumentation. As you can see, the CBC analyzer here using fluorescent tag molecules to identify cell populations. It has its own automated slide maker and slide stainer, and a digital automated microscope that will display the images in a PC, as you can see here. But let's go to the workstation where we can edit the images. And this is done now in lieu of the microscope. And are you ready for identification of the red blood cell morphology? Let's go. Here's our first panel of red blood cells, and you're familiar with most of these. Let's go through each one by one. Polychromasia is shown here. It's large red blood cell with a purple tinge. It's RNA stain, and you'll see this as the bone marrow is compensating for anemias, hemolytic anemias. And this is a good sign because the patient is reticking and the bone marrow is responding. If you see a large central pallor, larger than one third of the red blood cell, then this shows hypochromasia, and you'll see this commonly in iron deficiency anemia, also anemia chronic disease, and you'll see in megaloblastic anemia where there's not enough hemoglobin and the bone marrow is not keeping up to respond to make more hemoglobin for the red blood cell. When you see a big difference in size between the macrocytes and the microcytes, this shows anisocytosis, and the CBC will show a high RDW or red cell distribution width, and this is a sign that there are could be multiple transfusions where there's multiple red blood cell populations. It also could be a sign of a more of a chronic anemia progressing. A helmet cell or keratocyte is shown here. It's a red blood cell fragment, but bigger than a schistocyte. And you'll see this in hemolytic anemia as well as disseminated intravascular coagulation as the red cell is being shared by the disseminated blood clots within the intravascular space. A bite cell or degmocyte is shown here, and it's related to the helmet cell. And you'll see also in this is a sign of hemolysis. This blue ring with a red chromatin dot is a malaria ring form, and you'll see this in the Plasmodium genus. The species are Malariae, Vivax, Ovale, and Falciparum, the one that causes malignant malaria. And these are also will show signs. If you're an expert, you can tell the different species by multiple infections, Schiffner dots, Mars dots, amoeboid movement. But we have rapid malaria tests with immunochromatography, and there's also a PCR test to identify the malaria species. And later on, you'll learn in microbiology red blood cell parasites like Leishmania, Babesia, and trypanosomes. Pappenheimer bodies are irregular clusters of dark blue granules. These are iron granules in sideroblastic anemia, hemoglobinopathies, and thalassemias, as well as megaloblastic anemia. If you do a Prussian blue stain, you'll see these iron granules better. This blue ring or figure 8 ring is a Cabot ring, and it's a mitotic spindle remnant seen in megaloblastic anemia, and it's very rarely seen. You hardly see this. Rouleau in French means little roll, and this looks like a stack of coins in hematology. That's a rouleau formation, and you'll see this in a monoclonal gammopathy, such as multiple myeloma with IgG or Waldenstrom's macroglobulinemia with IgM, or inflammations. You'll see also a high SED rates caused by the rouleau formation. If you do a wet mount with normal staining, the rouleau will break up. New methylene blue stain is a supravital stain that will stain Heinz bodies. You've seen here, they are denatured hemoglobin precipitates, and you'll see this in G6PD deficiencies when they're exposed to oxidative drugs. A nucleated RBC or NRBC is also called a orthochromatic normoblast or metarubicite, and this shows a severe left shift in RBC hematopoiesis where the bone marrow is working hard to compensate for a hemolysis. Like in, there's a lot of reticking going on with hemolysis. You also see this in hemolytic disease, the newborn, otherwise known as erythroblastoma fetalis. Hello, welcome to our second panel of red blood cell morphology. And here we have a microcyte with hypochromasia. The diameter is less than 6 microns and the volume is less than 80 femtoliters. You have hypochromasia with a large central pallor greater than 1/3 of the red blood cell, and this is seen in iron deficiency anemia, as well as anemia of chronic disease, sideroblastic anemia, and thalassemias. And these are the microcytic hypochromic anemias where the hemoglobin is not made enough to compensate and for the red blood cells as they go through hematopoiesis. This sphere is a spherocyte. It's small. There's no central pallor. It's about 5 microns in diameter. And you can see this in hereditary spherocytosis, where there's a deficiency in a spectrin cytoskeleton protein. You can also see this in autoimmune hemolytic anemia and burn patients. The burr cell looks like a burr, or otherwise known as a conocyte, which looks like a sea urchin with this pointy projections. And you'll see this in burn patients, also conditions with uremia. And most commonly, you'll see this as a traumatic tap with somebody using a 21 gauge needle and shearing the red blood cells during the phlebotomy. Target cell, podocyte. These are seen in liver disease, alcoholic diseases, some hemoglobinopathies, as well as some thalassemias. A Avalocyte looks like a large oval. If you see more than 25% elliptocytes, then this may be hereditary elliptocytosis, where there's a spectrin deficiency in the cytoskeleton. But you'll see this in other conditions as well. Macrocytes are large, greater than 8 microns. The MCV is greater than 100 femtoliters, and you'll see this commonly in megaloblastic anemias with B12 folate deficiency, as well as myelodysplastic syndrome and liver disease. Stoma means mouth, and you'll see stomatocytes with a slit-like central pallor, and there's a condition called hereditary stomatocytosis. You can see this in artifacts as well as in some liver diseases. This round purple spheroid is a hollow jolly body, not a holly jolly body, and it is seen in sickle cell anemia or other diseases where they're missing a spleen, and this is the spleen is unable to take out this DNA fragment. These dark blue, purple, fine, coarse granules, these are RNA precipitates in basophilic stippling, and you can see this in lead poisoning as well as some thalassemias and hemoglobinopathies. Sickle cells look like a sickle, and they're also known as trypanocytes. They're thin, elongated, and pointy, and you'll see this, of course, in sickle cell anemia, but not in the trait. You can see this in also sickle cell beta thalassemias. Acanthocytes or spur cells are triangular, pointy. They're bigger than schistocytes, and you'll see this in liver diseases and hemolytic diseases, microangiopathic hemolytic anemia, autoimmune hemolytic anemias, and also beta lipoproteinemia. Schistocytes are RBC fragments. They are pointy, small, and you'll see this in microangiopathic hemolytic anemia, autoimmune hemolytic anemia, where there's a thrombotic thrombocytopenic purpura, and also disseminated intravascular coagulation, where the red blood cells are broken up into small pieces. Teardrop cells are known as dacrocytes, and they look like a pear or tear shape. And you'll see this in primary myelofibrosis. Hexagonal hemoglobin crystals are seen in hemoglobin C disease, and they have also different forms, as you can see. Well, that concludes our quick review of this most interesting topic. And to summarize, please be sure to watch the follow-up video, question and answer RBC morphology, modeled after the BOC study guide. And see you in our next video.